I'm Dr. Max Gatko and you're watching the Lux Dentistry channel. In today's episode, we are going to discuss how do you manage bleeding after getting your tooth or teeth extracted. Before we get started, let's not be lazy and smash the like button so more people like you can see and benefit from watching this video. To benefit the most, you should be ideally watching this prior to your extraction appointment. Prevention is the key. It's always easier to prevent bleeding problem in the first place than to deal with it afterwards. Possibility of prolonged bleeding and any questions regarding the bleeding should be addressed with your surgical dentist prior to the surgery. So what affects whether you are going to be bleeding after tooth extraction? First, your own medical history. If you're taking certain medications like prescribed blood thinners, an example would be Xarelto, Coumadin, Plavix, Eliquis, you will be expected to bleed more than an individual who's not taking those. Did you know aspirin is a blood thinner? Depending on the situation, your dentist may want to consult your medical doctor regarding adjusting or temporarily discontinuing certain medications that you are taking prior to that surgery. If you have a history of bleeding disorders and certain deficiencies like lacking enough vitamin K, you are expected to bleed more. Number 2, your current vital signs. Taking blood pressure, I believe, is an essential prior to any invasive dental surgery. The higher your blood pressure, the more likely you to experience bleeding. My general recommendation is to make sure you take your blood pressure medications, if you're taking any, and eat well-balanced meal prior to the dental procedure. Number 3, how many teeth are you actually getting extracted? The more teeth that needs to be extracted, the more bleeding should be anticipated. Also, the more difficult your teeth are to extract, the more invasive your dentist has to be with an extraction. That could also lead to a prolonged bleeding situation. Number 4, how did the surgery conclude? Depending on the treatment plan, your dentist may choose to do one or several treatment modalities. Example of such modalities that makes bleeding less may include but not limited to bone grafting, bone wax, stitches, collagen plugs, use of tissue glues, or electrocautery. As you can see, there are multiple options available to your surgical dentist armamentarium of how to effectively manage bleeding. The good news, for most of the folks out there who need a tooth or couple teeth extracted, do not worry. Your bleeding can be easily controlled by simply applying pressure with gauze on the wound site for several hours, and the rest your body will do on its own. Just avoid doing any strenuous exercises that day, that helps too. If you're watching this and it's been more than 2 to 3 hours post-dental surgery and you're still bleeding profusely, you should bite on a moistened black tea bag for 30 minutes while sitting still. Black tea contains tannic acid, natural anticoagulant, that helps you to form a clot by contracting your blood vessels. Remember, you are likely to taste blood for up to 24 hours after the surgery. That is normal. In very rare instances, if you tried everything, biting into the gauze for several hours, biting on the black tea bag while sitting still, and you still cannot control your profuse bleeding, contact your surgical dentist or emergency room immediately. Thank you for watching until the end. I hope you enjoyed this episode. Don't forget to smash the like button and to subscribe to our channel if you have not done so already. I wish you lots of health and good luck, and I'll see you next time.